lightly hold, and then you just gently lean. Hi everyone, Dr. David Arn here. We're going to go through a quick video about diaphragmatic breathing. So this is something that's so common with like seated or desk jobs where you're sitting and your diaphragm is kind of compressed, especially if you have any extra visceral fat or adipose tissue. There's not as much area or room for the diaphragm to expand downward, because as you breathe in and your diaphragm contracts, it pushes down. So the abdominal contents don't necessarily, if it can't push those down, or if it's difficult to push them down, then you'll use some of these accessory respiratory muscles like the sternocleidomastoid, might use the scalenes, and then they typically pull the ribs up using the neck as an anchor. So pull all the ribs up, and well, it's pulling on the neck at the same time. That can cause a lot of stiffness in the neck, and that can lead to pain over time as well. Okay, so let's try it. We're going to lay back, take a hand, one hand put on your stomach and one hand put on your chest. So you're going to breathe in through your nose, and your stomach should rise first, and then the chest will rise a little bit after. So we're really focusing on the stomach rising when you inhale, and then when you breathe out, you're going to breathe out through your mouth like you're blowing out a candle. So we're breathing in through the nose for about 3 to 4 seconds, and then we're breathing out through the mouth for about 5 to 6 seconds. So another thing you can try is if you feel like your ribs are really flared up, and by flared I don't necessarily mean painful, I mean like they're expanded. As you breathe out, you can kind of push in at the sides or push in at the top, depending on what feels restricted. So I'll breathe in, and then as I breathe out, I'm going to kind of assist my ribs with my hands. So trying to get a little bit more air out. And then that'll help sometimes if people can't breathe deeply enough, and this will happen with people who are kind of barrel chested or have COPD, then they can't breathe out that used air with a lot of CO2. So you need to help them kind of compress or teach them breathing techniques to get that wasted air out so they can get the fresh new air in that has a higher level of oxygen. Okay, now that you've learned how to breathe laying on your flat on your back with the legs in hook line, which is up in that position with your feet flat, that's the easiest to learn and teach yourself the diaphragmatic breathing. But then you want to transfer that into like either your chair or standing and still work on that breathing in, diaphragm, or the belly comes out, because you're using the diaphragm to breathe before the chest moves. So it's okay if the chest moves some, but the diaphragm and that abdomen should be the primary driver. So breathing out, breathe in, and then I get a little bit of chest movement there, and then doing that same breathing pattern in through the nose for 3 to 4 seconds, and then out through the mouth like blowing out a candle for 5 to 6 seconds. So training yourself to do that and doing it for a minute or two can help to really relax the neck and kind of calm down that stiffness, especially if you're sitting at a desk for a long day and you feel that stress, or you feel like you're leaning forward really into that work. As you're leaning forward, you're kind of crushing that abdomen, so there's less space for that diaphragm, and then you're more likely to start breathing with those accessory respiratory muscles. So straightening up the posture and then doing a minute or two of the deep breathing, that will help to kind of relieve that during the day. You might just have to be conscious and be aware and remind yourself to breathe with the diaphragm and to try to keep good posture. But if you continue to do that, that should help relieve some of that stiffness over time. Okay, so I'm just going to add in a bonus kind of stretch that can help target those scalenes. So you're going to find your clavicle, kind of how it comes around, and then your upper trap. So that kind of forms this triangle. And you're going to go right at the side of the base of the neck. And from the side, it's if you're sitting up straight, it's almost like following your earlobe straight down. So if I sit up nice and straight, head is back, following that earlobe down, right to the base of the neck. So these scalenes, there's an anterior, middle, and posterior, and they can all assist in that respiratory, accessory respiratory breathing. Lightly hold down. I'm going to switch back. So good posture, lightly holding down, and then you're just gently leaning to the side. You should feel that right from where your fingers are up to into the neck. Right about middle of the neck is where you mainly will feel that. So holding it for about 10 seconds. So we're not going for long stretches and we're not going for aggressive stretches. We're just doing light stretches for about 10 seconds, trying to get those muscles to calm down. And if you can tolerate the 10, okay, then you can kind of progress to a 20 or 30-second stretch. But we're trying to do light. We're not going to do moderate or hard stretches because you don't want to aggravate anything because the neck can be pretty sensitive. Thanks for watching. If you found this helpful, please like and subscribe. It would really help me out. And please check out some of my other videos.